Hi friends, today I am going to discuss about an important question regarding the ethical principles. If you are selecting this particular ethical principle, then you will fail. Come on, I will show you how it is. Let's dive into the question. A scenario says a competent adult client hospitalized for depression tells the nurse, I am planning to kill myself when I am getting discharged. And the question asks which nursing actions are ethically and legally required. Select all that apply. And we are going to the options. It says A. Maintain confidentiality. B. Notify the healthcare provider immediately. C. Initiate the suicide precautions. D. Respect the client's autonomy. E. Document the client's statement. Here the NCLEX trap is that we always think that maintain confidentiality. If you're thinking so, this is the trap. It is always wrong. When there is a suicide threat and there is an imminent danger to the patient, always the confidentiality ends when there is risk or harm to self or others nearby. So there is a legal duty of a nurse to warn and protect, right? We have to warn the nearby patients or the staff, and we need to protect the particular client. And if you are selecting respect the autonomy of the client, and again this is wrong friends, because autonomy applies only when the safety is not threatened, right? So suicide plan by the patient, it indicates that loss of autonomy and protection, right? So there is no self protection for that patient, right? So we need to give protection and safety to this particular patient. So the right answers are notify the healthcare provider immediately and initiate the suicide precautions and document the client's statement, right? We can see why these are the correct. If you are initiating the suicide precautions, we are ensuring the safety of the patient. So on, we have to create a one-to-one observation in such type of patients, and there is an proper SOP. They are given one-to-one supervision, and they are being routinely watched, and it is being reviewed by the medical officer after 24 hours. And we have to remove all the harmful object from the surroundings. And next one, we need to notify for the healthcare provider immediately. Yes, this is the correct option. And this is the thing we need to do immediately when the patient is in self-harming. And third one is we need to document the exact client statement and what quotes, what is the statement he is used. So we need to note down and we need to document such findings. So the NCLEX word is that what is the we need to see is like competent adult, or the phrases like after discharge. The option that sound respectful, but it is legally unsafe because the patient is under depression. If the client says the nurse should act on it, if the patient is very confused and is on depression, so we should act on it and we should think ahead and what is going to be very risky to the patient. The one-line memory exam hook is we need to prevent the suicide risk. This particular suicide risk cancels the autonomy, the privacy and the waiting for the patients, right? So, and here the core rule which we need to memorize in case of ethical principle is autonomy never overrides safety. If it is coming to the patient safety, always autonomy stands out. So if there is an expected self-harm or to the others, then we have to act immediately. The immediate intervention is the must. There is nothing like privacy which is important to such kind of patients. So we need to approach this type of question in this way. Thank you friends.